Dr. Benameur, or Dr. V, graduated from the University of Oran in Algeria, where she received her MD degree. She trained at the National Institutes of Health, where she was awarded the Excellence in Research Award. She moved to Atlanta to complete her residency and fellowship at Emory and was selected as Chief Resident of Education. She was then appointed to her current position on Emory faculty in the Department of Neurology in 2014, where she's an associate professor and is a part of the neurohospitalist team. Her daily work consists of taking care of hospitalized patients with acute neurological diseases and educating residents and medical students. She sees firsthand the effects of poor nutrition and a sedentary lifestyle on brain health, as it presents in a myriad of neurological diseases, the most common of which is stroke. She's passionate about the intersection of nutrition and neurological diseases and teaching patients and their families, and also other physicians and medical students about the effects of nutrition on disease and on health. So we are super excited for the presentation, and any questions that you have throughout, you can go ahead and put them in the chat. That might be the best way to be organized and good, but also however you want to do it, Dr. B also. So yeah, I'll pass.
Thank you so much, Emma. And thank you for inviting me. As Emma said, I am what they call a neurohospitalist, meaning I do not have a clinic where I follow patients. So I see patients when they are hospitalized acutely with a stroke as it's happening, or sometimes they show up a couple of days later. And my passion is in nutrition and brain health in general. But because we actually, unfortunately, are in the stroke belt, I see a lot of stroke. And so a lot of what I do applies mostly to stroke in my patient population. So I'm going to share my screen. All right. So I'm going to be talking about nutrition in stroke. I have to say that when I was training, when I was doing my neurology residency, I was really never, and actually even in medical school, I was never educated about nutrition in health. I mean, everybody knows that diet is important for good health, but we didn't actually have any formal training for me anyway. My interest in nutrition came from the fact that as a neurohospitalist, I get to see patients, order their meals while they're in the hospital. So I get to see what they eat. I open their trays, I see what they ordered, and I started becoming alarmed at what was being served in the hospitals. And really, that's where it all started. So everything I have learned about nutrition, it was and brain health, it was because I sought out the information myself. I went through the literature to see what we know, what there is evidence for, what there isn't evidence for. And today, what I will be talking about is what there is evidence for, because a lot of times, patients will be sold snake oil, like do this and take this supplement and that supplement. And I just want you to have the right information. I do not have anything to disclose. I don't have any commercial benefits from any of this. I'm just going to take you a little bit through a story. So the way the talk is structured is that I'm going to take you through the history of how nutrition and cardiovascular disease in general came about. And then we'll talk about the different macros, so protein, carbs, and fat, and the different dietary patterns and what we know about them in stroke. So the story about, what we call atherosclerosis, so, the plaques that are in the blood vessel that cause your blockages, starts back in 1913. We had known for a long time that patients had atherosclerosis. They would do autopsies on patients that had died, and they would see these plaques in their blood vessels, but they didn't know what was causing those plaques. And so there was this Russian scientist, Dr. Anichkov, who was a pathologist. So, one of the people that do the autopsies, and his hypothesis was that if when you look at the atherosclerosis plaque or the atheroma plaque, it's made mainly by fat, by cholesterol. And so his hypothesis was that it must be the fat that we're eating that's causing these plaques. So he did an experiment on rabbits. He grabbed a bunch of rabbits and fed them an animal diet. So rabbits eat grass, and he fed them a diet that was high in animal fat, and then sacrificed the rabbits and saw what happened to them. And he found that the rabbits that were fed animal fat had more atheroma plaques. So that was kind of the first observations. Around the same time, a Dr. Snapper, who was a Dutch doctor, internal medicine doctor, who went to China to teach in one of their medical schools, this was in the 1930s, noticed that people in China really did not have much heart disease at all. Back in that time, 1930s, 40s, 50s, there was a lot of heart disease. People were having a lot of heart attacks. And he just noticed that compared to the Western hemisphere, the US and Europe, people in China really didn't have much heart disease. And so he wrote this book called Chinese Lessons to Western Medicine. His hypothesis as well was that it must be what the Chinese are eating that's protecting them from heart disease. And this is a picture of a few scientists. I don't know if you can see my cursor, but this right here is Ansel Keys. And Ansel Keys was a physiologist who was married, did not have kids, and he really liked to travel, him and his wife. So they traveled all over the world. And being a scientist, he was a keen observer, and he noticed at one point when he was around the Mediterranean that people in southern Italy really did not have much heart disease either. And so that was the beginning of an experiment or a study. It was not really an experiment, a study. The first studies that were done that tried to look at the relationship between diet and heart disease. And that was called the 7-country study. Since then, there have been many studies. So the study that he did was what we call an observational study, meaning you just observe people and you look at what happens to them over, 15 years, 20 years, but you cannot infer causation. You can only see correlations in these studies. Since then, there have been trials, clinical trials, where you can infer causation that have shown, that have taught us a lot. And so I'll go through all of that. So this is the 7-country study. And what he did was that he designed this study where they took multiple cohorts in different countries around the world. So there were a couple of cohorts in Italy, one in the US, one in what used to be called Yugoslavia at the time, in Serbia now, Japan, Canada, Australia. And all they did was they basically were recording what people were eating and then following them throughout the years to see whether they developed heart disease and what they died from. And the study actually was started in the 1940s and is still ongoing to this day. And this was the first result of that study, where you can see here this line, this correlation. So here on the y-axis, you have the number of deaths per 1,000, and here you have the percentage of fat from your total calories. And when you have a line like this, what this means is that there is a direct correlation. The more fat in your diet, the more deaths. So the US here at the time, people were consuming about 40% of their diet was made out of fat. And then Japan down here, they had less than 10% of fat in their diet. And you can see the mortality in Japan from heart disease. So this is mortality from heart disease, is very low, whereas in the US, it's the highest. And so he concluded that, the fat consumption is what's causing the difference between the deaths from heart disease in these different countries. Like I said earlier, it was an observational study, so you cannot infer causation. So then they did clinical trials to see whether really the fat was what was causing the deaths from heart disease. And the first trial was called the Minnesota Coronary Experiment. And what they did, so this was done, I want to say in the 1960s, perhaps, or 70s. And what they did was that they had patients in nursing homes and in mental institutes. and they randomized them. So they had two groups, one group where they were eating the regular 40% fat with mainly saturated fat. And then the other group, they engineered the food to where it would look the same as the other groups, but they had replaced the saturated fat, which comes from the animal fat, by unsaturated fat, vegetable oils. And so this is just to show you the saturated fat here. It was about 15% in the control. And then in the intervention, the group that they were doing the study on, they reduced the saturated fat to about 10%. And they watched what happens. And I have here this red box that shows you the difference between men and women. And you have here the treatment group and the control group. So in the treatment group, you actually, if anything, have more deaths than in the control group. There is no change, no difference between women and men, in women between the control and the treatment group. So this is for heart disease. And then right under it, they call it vascular lesions of the central nervous system, which is stroke. And as you can see here, there's not much difference between the two groups. Nevertheless, the Ansel Keys was somebody who was actually really well connected, had friends in Congress, and he was really lobbying Congress people because he was convinced that fat was what was causing the heart disease at the time. And so McGovern, who was a politician at the time, came up with a McGovern report that was published in the 1977 that looked at dietary goals for the United States. So these were the first US dietary goals, were that you needed to increase your carbohydrates to about 60% of what you eat and reduce your overall fat consumption to 30% maximum, with saturated fat being about 10% maximum. You needed to reduce cholesterol to a maximum of 300 milligrams a day. And as an example, one egg has 240 milligrams of cholesterol. So you couldn't have more than one egg a day. You needed to reduce sugar and reduce salt. And right after the US dietary guidelines, this food pyramid came out. So as you can see, the base of the pyramid, 60% is all made of carbs, grains, and then you have the fruits and veggies here, and the fat and the sweets all the way at the top, moderately or sparingly. And so this was a time where cholesterol was vilified, right? You could have, you had things on the shelves in the stores that, you would find a fat-free Twinkie because it was healthy, because it was fat-free. Everything became fat-free. And eggs became vilified. You can have more than one egg a day. And there were huge campaigns that were done at the time to tell people to not eat fat. And Americans listened. So this is the NHANES study, which is done by the CDC that follows every 5 years, I want to say. And yeah, every 5 years. And so you can see here this is the time where the McGovern report and that food pyramid came out. And then so people went up with their carbohydrate consumption, decreased their fat consumption. Protein really never changed much. And you would see things like this in commercials, bad fats and good fats, and saturated fats are bad for you, and trans fats are bad for you, and consume vegetable oils are much better for you. And so I want to go through what the evidence is, because as you can see, as I have told you so far, the evidence when it started was made from observational studies where you cannot infer causation. So trans fats have been shown in many studies. It is irrefutable that there is a direct correlation between causation, actually, between trans fats and heart disease and strokes. This has been shown in multiple things, and trans fats is your Crisco, your fats that are basically engineered to where they don't go rancid, so that they have a longer shelf life. So, your margarine and your Crisco and all the fats that are used in pastry products, so that they don't spoil and, stay on the shelf longer. Saturated fats, as I told you earlier, so the data for the saturated fats had come from the 7-country study. There was actually a scientist at the time who was not convinced about the fat causation of heart disease. His name was Yerushalmi, And he published in 1957, right after Ansel Keys had published his findings. He had gone through data that was available from different countries. It was publicly available data, and he just plotted all those countries that had publicly available data about their diet with deaths. And as you can see here, that nice, pretty line of strong correlation is not there anymore. So, for example, number 8 here is France. The French are not known to have a low-fat diet. They love their cheese. And the more fatty the cheese, the better, the creamier, the better. And they do not have much heart disease. They call that the French paradox. You have this cluster over here, that's the Scandinavian countries. So the Netherlands, Sweden, and they have a really high fat consumption in their diet, and yet they were not having too many deaths. And so he published this, refuting that hypothesis or the paper that had come out by Ansel Keys, saying it's really not the fat that's causing the problem. I had talked to you earlier about the Minnesota coronary trial, where they were inferring causation and not correlation. So there's a scientist at the NIH who has made a career out of digging out old data and reanalyzing it. He literally goes into basements, digs out old data from the 1950s and just reanalyzes it. And so this one was one of his studies that made a lot of noise. It came out in the British Medical Journal, which is a really highly respected journal. And he reevaluated the Minnesota coronary experiment. So this is a busy slide, but what this shows you here is the proportion of the patients that died in that trial. And this was the probability of death. And here you have the change in serum cholesterol. And as you can see here, so this is 0, these are negative numbers and these are positive numbers. So the more negative numbers, the lower your cholesterol was going. The more your cholesterol was going, the more your cholesterol was lowering, the higher your probability of death and the higher proportion of patients actually died. So the more they lowered the patient's cholesterol, the more deaths there were in that group, in that study. And this was mainly seen for people who were aged more than 65. So the diet group is here and the control group is the red, and mainly for women. The other ones, they were not as strong. And as I said, he has made a career. So there were many experiments at the time that looked at replacing saturated fat with vegetable oils. This here shows you that it favors control and this favors the diet. And as you can see, all these are trials. This is what's called a meta-analysis. And he shows that there was really not much difference. And in some of these studies, it was even favoring controls. This is a study that's actually a really large study. It's called the U.S. Male healthcare professionals, and it's another observational study that's done in U.S. male healthcare workers, so physicians, nurses, mainly, and they just followed them. It's actually still ongoing, and this was the 14-year results that were published in the early 2000s. And as you can see here in the box, so a p-value of less than 0.005 is what you would call something that's significant, that is a positive study. These are nowhere near less than 0.005. So this is the total fat for ischemic stroke or hemorrhagic stroke, total fat consumption. And they found that there was really no correlation between fat consumption and risk of ischemic stroke or hemorrhagic stroke. And when they actually looked at where that fat was coming from, whether it was animal fat, whether it was, plant fat, there was no correlation for any of them. So this is red meats, high fat dairy products, nuts, and eggs for ischemic strokes and hemorrhagic strokes. And I know this is a very busy slide, and I really, I'm glad that it's being, that this talk is being recorded so that you can go back and look at the numbers yourself. And there was no correlation between any of these. And so as far as stroke goes, there are a lot of trials that show that there is no correlation between saturated fat and stroke. neither stroke, nor stroke severity, nor stroke subtype. And there's no correlation also between stroke and red meat. You know, a lot of times I will hear physicians say, avoid red meat, you know, white meat is better for you. There's really no data that supports that. This is the latest study that actually looked at the relationship between saturated fats and health in general. It was called the PURE study. And the PURE study was kind of like the newer version of the 7-country study. It was done in 17 countries. And this time what they did was that they took countries from low income, high income. They wanted to have a really good picture of everywhere in the world, not just you know, countries that had good healthcare. And what they found was that, so here, this is, just to orient you, this is the energy from total fat. This is saturated fat. This is monounsaturated fat, polyunsaturated fat, and carbs. And this is total mortality. So for total mortality at the top and cardiovascular disease, major cardiovascular disease at the bottom, so heart disease and strokes. And as you can see here, the line is flat when it comes to saturated fat. So no correlation. And it's even going down, which means it's protective for fats, for total fats, and for cardiovascular disease and for mortality. What really was making a lot of noise was this line that was going up. The line going up means there's a strong correlation. And this was a strong correlation for major cardiovascular disease and for total mortality from carbs. And here, so they did, you know, very fancy statistical work on these in this study, trying to look at what would happen if you replace those carbs that were causing the increase, that signal of increased mortality and increased cardiovascular disease. What would happen if you replace those carbs by fat? And so, as you can see here, it was a little bit protective for heart disease, but it was actually very protective for stroke, replacing the carbs by. And so I'm going to skip this a little bit, but this is just to tell you that the data that has been going on for the last few years has been so strong that the American Heart Association, as well as the government, you know, the Department of Agriculture and the dietary guidelines for Americans have changed their recommendations. They used to say you have to keep your total fat to less than 30% and your saturated fat less than 10%. In 2013, the AHA removed that recommendation, and in 2015, the Dietary Guidelines for Americans removed that recommendation. They do not, the Dietary Guidelines for Americans still says keep your saturated fat less than 10%, but they do not say to keep your total fat less than 30%. And this is not something that has made a lot of noise. It should have, but it kind of went down under the radar.
So why doesn't that raise a red flag with the various dietitians or the doctors, or because I mean, as a survivor, you don't necessarily know that, and we are getting counsel from the professionals, but that is not being filtered down.
Right. To be honest with you, even the professionals, you know, the physicians, at least I can only speak for the neurologists. I cannot speak for other specialties. But in neurology, nutrition just does not figure in what we do. There is a complete breakdown between understanding that brain health and diet are very interconnected. You will find a few neurologists who have an interest in that and who are on top of the literature. But you know, they are usually the rare birds. So I will go through a little more, because I realize that this is kind of counter to what you have always been told, right? You're always told, you know, skim milk and this and that. So I've talked ad nauseum about fat. I'm going to switch to carbs. As I told you earlier, you know, carbs, we were told that first food pyramid, you know, the majority of your plate should be carbs, 60%. And so Americans listened. And what what they did, this shows here what kind of carbs actually increased, because there are carbs and then there are carbs. So people did not all of a sudden start eating, lentils and fruits and vegetables. What they started eating more was cereals and sugar. That's the carbs that increased. And with that, what's called the diabetes epidemic started, the diabetes and obesity epidemic. So here you can see that this is kind of around here, the time when that first food pyramid came out, the carbohydrate consumption went up. So this is carbohydrate. This is the prevalence of diabetes in the US, and this is the prevalence of obesity in the US. And you can see a straight line. People just started eating more carbs, more sugar, more cereals. Diabetes and obesity went up. So let's go through the different carbs, because carbs are a little bit tricky. It's a big umbrella that encompasses a lot of things. There is no question that carbs in the form of sugar, when it comes to sugar sweetened beverages, are no good for you. And a lot of times, my patients will say, but it's fruit juice. It's fruit. Fruit juice is pure sugar. It does not have the fiber in it that protects you from that big sugar spike and the insulin spike that comes with it. As Reagan said, Mrs. Reagan said in the past, just say no. I don't know if she's the one who said it or not, but sugar sweetened beverages are just no good for you. Many studies have shown that. And I would even go, there are even studies that show that even diet drinks actually increase your risk of stroke and of dementia. So replacing your Coke with a Coke Zero or a Diet Coke is not going to do it. So the evidence for this is just, not something that is up for discussion. So where do carbs mainly come from in the American diet? They come actually mainly from processed food. So processed and ultra processed food represents 60% and 90% of calories and added sugars in the American diet. And one thing that kind of allows you to look at, what is processed food? Is it pasta? Is it bread? Well, what is processed food? Everything is processed, right? Everything, unless you're buying a fresh fruit or a fresh vegetable, that's not processed as it comes from the farm. Everything else goes through some stuff. And, what degree of processing are we talking about? So one thing that can help you, that kind of help you evaluate how much processing of food goes through is by looking at their glycemic index and the glycemic load of that food. So what is glycemic index? The glycemic index looks at the quality of the food, and it ranks foods based on how fast they make your sugar go up in your blood. The glycemic load looks not only at the quality of the carbohydrate, but also the quantity. So, for me, I like to look at both. I like to look at glycemic index and glycemic load to decide whether I'm going to eat this or not. But here's an example that I found to be really eye-opening. This is an old article from The Lancet in 1977, where they did an experiment. They took an apple and they processed the apple. So first you eat a whole apple, and they looked at what your blood sugar did and what your blood insulin did. So this is the apple up here and here. Okay, normal apple, and then the insulin response to it down here. And then they took that apple and they processed it. So there was a slow puree, a fast puree, a slow juice, and a fast juice. And they tried to look at what that does to your glucose and to your insulin. The more the apple went through processing, the higher your insulin level. So this is a fast juice, which is apple juice that you buy in the store. And the more you risk of what's called rebound hypoglycemia. So this is about an hour to an hour and a half after your meal, you become hypoglycemic from having had that apple juice, which causes you to be hungry, because that hypoglycemia is telling your body, I'm out of fuel, I need more. And so people are eating every 2 hours. Right? I mean, we did not evolve to eat every 2 hours. We would have been extinct, if we were to eat every 2 hours. And so this is an example of what happens when you take a whole fruit and you process it to different degrees. Here is another example of wheat, right? So wheat, a whole grain of wheat is actually not bad for you. But when you take, here's the whole grain here. And then when you take that grain and you start grinding it into flour, so you have the cracked grains, the coarse flour, and then the fine flour. The more you grind it, the higher the insulin level, the higher risk of having rebound hypoglycemia, the hungrier you get. So that's what food processing is. And so here is a glycemic load example of different foods that we eat. You know, a lot of people, at one point, the keto diet was, you know, the thing. Everybody was on keto, and keto is good for you. And actually, ketogenic diet is very good for certain things in neurology, like in epilepsy. We've been using it since the 1920s for people with seizures. But it kind of went overboard, because then people started telling you, oh, you can't eat an apple, that's not keto. So here is a glycemic load of, you know, here's a glycemic load of an apple. Here's a glycemic load of a full-fat Greek yogurt. Here's a glycemic load of rice and rice cakes and cornflakes. And you can tell, right? So whole nature-born food as it comes in nature and what it does to your glycemic levels and your insulin levels versus food that is processed. And rice is actually a processed food. So there actually have been many studies looking at the benefits of a low glycemic index, a glycemic load diet. In diabetes, it is, you know, every diabetic is told to eat a low carbohydrate diet. That's just part of the diabetic education. Actually, I take that back, because when I started actually initially looking at this, I went to the diabetic educator in the hospital and I said, you know, what are you teaching patients? And what they were teaching them was to recognize signs of hypoglycemia. They call that the survival skills. And so, you know, recognize that when you're shaky, your blood sugar is probably low, recognize, you know, how much insulin to do and not to use and all of that. But if your diabetes was not too bad, you never got to see a dietitian, because your diabetes was not too bad, and too bad is 9%. At 9%, it's already too bad. I mean, we're not going to wait for people to have an A1C of 15% before we tell them what to eat, but that's how it is in the current healthcare system. So these are various studies of the benefits of a low glycemic index diet, looking at hemorrhagic stroke, ischemic stroke. So this is glycemic index at the top and glycemic load. And as you can see here, all of them favor. So the line is 0, and the more to the right you go, the better it is. All the studies favor patients with stroke going on a low glycemic index diet or a low glycemic load diet to reduce the risk of having another stroke. This is one thing that I tell my patients, every single patient that I see, is there's a meta-analysis that looked at 20 studies of stroke. And what they found was that patients that have the highest consumption of fruits and vegetables had the lowest risk of stroke. And for every 200 grams of vegetable that you eat, you actually decrease your stroke risk by 1/5. That is huge. You know, if I were to take a pill every day that reduced my risk of stroke by 1/5, I'd take it every day. There is no pill in the stroke world that reduces your risk of stroke by 1/5. It doesn't exist. We wish, but fruits and vegetables do that. And then, so as far as protein, you know, I'll see a lot of patients in the hospital who tell me, oh, you know, it's probably the red meat that I've been eating. I told you earlier what the red meat data shows. There's no difference between red meat and white meat. But the one kind of protein that has been actually shown to be very good and protective in stroke, and actually even in dementia, is fish and seafood. And in Atlanta, I have to tell my patients, not fried fish. Because, you know, you take fish and you fry it, it kind of undid the good stuff that the fish does. So not fried fish, but broiled, sauteed, you know, with a little bit of olive oil, Eating it 2 to 3 times a week is actually protective up to 30% against stroke. I can come back to this protein, but I'll come back to this slide in a little bit. So, how do we eat? When we eat, we're not looking at very few people, as maybe the bodybuilders will look at their macros and look how much protein they're eating. But you and I, people who are not, bodybuilders, we're not looking at our macros. I get a plate of food. I don't want to count calories. I don't want to track anything. I just want to eat and enjoy my food. So let's look at the dietary patterns. So this is the DASH pattern. The DASH pattern was the first dietary pattern that was looked at. And the DASH was a pattern that was devised for patients with high blood pressure. And the only thing they did really was, if you look at the pyramid here, they told patients, instead of having that bottom of the pyramid be full of carbs, just put the fruits and veggies at the bottom. We're not telling you don't eat grains, but less carbs, less grains than fruits and veggies. And the rest was the same. And they did a study looking at the effect of the DASH diet on their blood pressure, and it reduced blood pressure. Putting the fruits and vegetables at the bottom of the pyramid, so making sure that half your plate is vegetables, reduced people's blood pressure. And I will tell you, in my stroke patients, hypertension is the most common risk factor that we see that drives people's strokes. So the DASH is, it is a low-fat diet. It was devised in the very early 1990s, kind of late 1980s. In the last, maybe in 2018, there was, with all the data about fat not being as bad for you as we thought, there was a study that was done that was called the high-fat DASH diet. So they took people and randomized them to the DASH diet versus the higher fat DASH diet. And they looked at what happened to them. And just as a note, the patients that had been on the DASH diet was really good for reducing your blood pressure and reducing your LDL, which is your bad cholesterol. Unfortunately, it also reduced your HDL, which is your good cholesterol. And your good cholesterol, you want it to be up, because that's very protective against heart disease and stroke. So in the study where they did the DASH versus the high fat DASH, they saw no difference as far as high blood pressure goes and LDL, but they also saw that they did not drop their HDL. So the HDL did not drop like it did for the low fat diet, and their triglycerides went down. So that was a really good thing that, basically you just needed to eat more fruits and vegetables, and you didn't need to worry a lot about your diet, about your fat, and drink skim milk and all that. The Mediterranean dietary pattern is the pattern that is most studied in stroke. And Mediterranean is, it's all the countries that are around the Mediterranean, but mainly Italy, Spain, Greece. So there have been many studies looking at Mediterranean diet and stroke risk. And all the studies showed that the more your diet was kind of Mediterranean style, the lower your risk of having a stroke. And even when you did have a stroke, you were going to have a smaller stroke, which means less deficits, right? Less weakness, less paralysis, less speech problems, aphasia, that kind of thing. The stroke severity was less. The biggest study that was done for the Mediterranean diet was called the Predimed study. This was done in Spain. And they randomized people to 3 groups. So they had the group here where they told them, you're going to eat Mediterranean style, but we want you to, in addition to that, add 4 tablespoons of olive oil to your diet. Have more olive oil. There was a group where they told them, we want you to eat more nuts. And then there was a group where they told them just usual care, which is low-fat diet, which is what we had been telling people to eat, low-fat diet. And so, so this just shows you kind of how this was. And what they found was that the patients who were on the Mediterranean diet did much better than the patients who were on the low-fat diet. And they looked at their risk of heart attacks, stroke, and death from either heart disease or stroke. And they found that that difference actually was driven mainly by stroke. So a 33% decrease in stroke risk when you are on a Mediterranean diet. Like I said earlier, a lot of my patients will say, well, you know, I'm vegetarian. I'm vegetarian. How come I had a stroke? So, you know, the vegetarian kind of vegan patterns, I personally do not have anything against vegetarian or vegan. A lot of people are on vegan diets for religious reasons, cultural reasons. Some people it's for environmental reasons. But I can only tell you what the data shows. The two biggest studies that looked at the, you know, the vegetarian and vegan diets and their risk, their effect on your cardiovascular risk are the Portfolio study and the Ornish study. And in both, they put people on vegan diets, but they also told them to stop smoking, exercise, meditate, you know, and then, you know, the results were that it decreases your risk of high blood pressure, diabetes, obesity. Of course, it's going to decrease your risk of high blood pressure, diabetes, and obesity. You know, you are exercising, you're not smoking, you're meditating. All these are good for you. You cannot infer that it was the vegan diet that was driving all this. Having said that, when my patients say that they are on a vegan diet or a vegetarian diet, I tell them that, you know, the two caveats in those diets are that a lot of times people on the vegetarian diets or vegan diets eat a lot of processed carbs, a lot of pasta, a lot of bread, a lot of rice. Yes, they are plant-based, but they are processed, and I showed you what the processed food does. So if you are on a vegetarian diet where you're eating mainly fruits and vegetables and lentils and beans, that's really good for you. But if your vegetarian diet is based on a giant bowl of pasta with a few veggies, that's not good for you. And the other thing is that when you are on a vegetarian or vegan diet, you are at a high risk of vitamin B12 deficiency because vitamin B12 comes from animal products. And vitamin B12 deficiency actually causes an increased risk of stroke because it drives up what we call homocysteine. So if you are going to be on a vegetarian or vegan diet, be mindful of those two things. You know, limit your processed carbs and take a vitamin B12 supplement. And I spoke earlier about the ketogenic diet. So as I said, the ketogenic diet is actually well-researched. It's, you know, we prescribe it to patients with epilepsy. To be honest with you, I feel like we don't prescribe it enough because usually what happens in the epilepsy clinic is that they put patients on medicines. And then when they can't control their seizures on various medicines, then they go to the ketogenic diet. Whereas, you know, in my opinion, we should start with lifestyle and then, you know, and lifestyle with one medicine, see where we are, and then maybe pile on the medicines with all their side effects. So like I said, ample data to support its use in epilepsy. And there is actually a lot of data now to support its use in certain brain cancers, glioblastoma, in Alzheimer's disease, and Parkinson's disease. There is no human data that shows its effect on stroke. And the reason for that is because there is still that thought of high fat is bad for your heart, bad for stroke. That's, you know, that's something that has been there for, you know, more than 50 years. It's going to take a long time for people to change their culture. So those trials are just not going to be accepted when you apply for funding to do a ketogenic diet in stroke patients. People are going to be like, are you out of your mind? We're not feeding stroke patients fat. So that has not been done. Having said that, the animal data shows that when you put animals, so, you know, lab rats or mice, on a ketogenic diet, and then you cause them to have a stroke, they actually have less deficits from a behavioral standpoint, from a motor standpoint, you know, their weakness is less. And so that's the data we have for the ketogenic diet. But it's animal data. We think that it's protective, but it has not been done in humans. And so that's what I have today. I really hope that, you know, I brought attention to, I hope that I brought you good information and that this is helpful for you. And, you know, I often tell my patients when they come in the hospital with their stroke that I'm already too late. You know, when I see you with a stroke, it's already too late. I wish I could go to churches and I have done that, but I wish I could do more, going to churches and, you know, community events and telling patients that what you eat is so important for your brain health, because I will see patients in their 40s who are having strokes. And actually, I was just on call this weekend, and I saw this 45-year-old lady who, came in and had a TIA. A TIA or a mini stroke is the same as a stroke. It's a warning sign telling you that you got to pay attention to what's going on. And nobody had talked to her about her diet because she did not have high blood pressure. She did not have diabetes, but she was morbidly obese, and she had fatty liver disease, and that's a sign of insulin resistance. And so, I think it would be really helpful if you guys could spread the information around. And I'm happy to take any kind of questions you guys have.